everyone, Hannah here from Preferred Physical Therapy, where we help people age 40 and above stay active and independent, live free from painkillers, and avoid surgery. So this month we have been talking to you guys all about the elbow, and this week specifically I'm talking to you about golfer's elbow or medial epicondylitis. Whether those terms sound familiar to you or not, I'm going to be talking to you guys just a little bit about the diagnosis and some of the treatment that we would do here in clinic. So golfer's elbow, or like I said, medial epicondylitis, it's really a repetitive use injury of the elbow. A lot more common term is the tennis elbow, which is pain more on the outside of the elbow where you have tenderness, maybe pain with gripping, some more like extensive movements of the wrist, where golfer's elbow is the opposite. So you have pain more on the inside of the elbow, more pain with gripping things. You can have pain bending the elbow or the wrist in. Even doing like some bicep curls sometimes can also cause some discomfort along the elbow. And what we see is typically when people come in right away, right when things start bothering them, their elbow isn't terribly stiff. If you let this kind of drag on for a couple months, you may start to notice more limited range of motion in the elbow. Whether you're not able to bend it all the way or straighten it all the way, you start to notice some little changes here and there. And another thing that people start to notice is they're losing a little bit of their strength. And not only that, but it's becoming more painful, especially when we test strength out here, like hold this position here, don't let me push it. They're painful, especially with the wrist flexion, maybe even turning the palm up and down. All of that is going to start to irritate the muscles that attach into that medial epicondyle of the elbow. And really what that big muscle group is the flexor muscles of the wrist. And it's also the supinator muscle, which is when you're turning from palm down to palm up. That motion is going to be supination. So all of those muscles go in and attach right at that medial epicondyle. So in doing any of those motions, exercises, whether it's repetitive things that you're doing daily at work or even at home, is you're going to start to develop some tenderness and pain in that area. So a couple things that we suggest that patients do is rest, stretch, exercise, ice, and just being aware of what you're doing in your mechanics. So it's not always as simple to rest. If it is your job to be working on cars, or it's your job to be a receptionist, you're always working at the computer, we can't just tell you to stop what you're doing. What you can do is be aware of how long you're doing that activity and maybe take more frequent breaks, even for just a couple minutes or so, just to allow yourself a little break in between. That way you're not doing that repetitive motion for 7 to 8 hours a day. Maybe you're doing it for an hour at a time, and then you take a couple minutes, maybe do some stretches for the wrist and the elbow just to give you some relief. And as far as strengthening exercises go, when patients are in here, I tell them not to do anything that's painful. I'm okay with some discomfort during strengthening exercises, but none of these should be painful or causing symptoms. So, in my Technique Tuesday video, I had 2 easy strengthening exercises that you could begin to incorporate into your daily routine if you're starting to have these symptoms. And you may not be able to start off with a 2-pound weight doing some of the things that I showed you. You may not be able to use the soup can. Sometimes you just have to work with body weight or without holding any weight or resistance, and that is okay. That is just where we're starting, and then we're going to build up our strength from there. So in doing some of the stretches and strengthening things, if you're experiencing golfer's elbow or anything like that, do make sure that you're being aware of how much you're doing it, how frequently, and that it's not irritating. None of these should be causing more symptoms and more pain. That's not the point of them. So those are just a couple brief things that we would do in clinic here, and some of the diagnostic things that we are looking out for when you do come in with pain on the inside of the elbow. And you can always look up different videos of whatnot on YouTube and do a couple of those things. But again, just be aware of the intensity that you're doing those at, and just make sure that it's not becoming more and more painful or more uncomfortable for you to do. So if you guys have any questions, maybe about golfer's elbow, medial epicondylitis, or anything else related to the elbow or the entire body, you can head over to our website where there's more videos like this, more blogs that you can read to answer a few questions. There's also a couple quizzes. We have YouTube, Instagram, Facebook that you can subscribe to just to be in the know of what's going on in the clinic and more information that we're putting out there for you guys. So hope you have a great rest of your day and week heading into the weekend. Stay safe, stay healthy, and enjoy, guys. Bye.